Hi, I'm Lisa Groon. I'm with the Alzheimer's Association, and I'm pleased to be here with Dr. Vijay Ramanan today. We're excited to discuss the upcoming Mayo Clinic Conference on Brain Health and Dementia. And one of the things that we've learned from the Alzheimer's Association Facts and Figures report that comes out annually is that some patients have some difficulty discussing brain health during their appointments. And we're going to talk with Dr. Ramanan about his experiences in a clinical setting. Can you tell me more about any experiences that you've had or your perspective on patients coming to you with concerns about memory or cognitive health and how you've engaged with them on that?
Such an important question. I think any of us who have experience with a family member, with a patient, with a friend, someone who's had dementia, we know how devastating that can be on so many levels: personal, interpersonal relationships, financial, social. And that in and of itself can create a bit of a stigma and fear and apprehension, which is understandable, that you may not want to talk about these things. You may not want to surface them with your family members or friends, let alone with your clinician providers. So I think the burden is on all of us together as a community, including us as clinicians, to try to build the relationships and trust and culture that facilitates patients sharing their concerns about their memory, other parts of thinking, and brain health, because what we know is that identifying issues early doesn't do anything except allow you to optimize management early. And my goal for any one of my patients is, whatever problem they're dealing with, however it looks like to that individual, what can I do to make their quality of life and day-to-day existence as good as possible for as long as possible? Having those conversations is a first step to that.
Right. You mentioned clinicians building rapport, building trust with patients. One of the things that we know is that as we start discussing cognitive health in a clinical setting, more often in a primary care setting, what are you learning about a clinician in a primary care setting's skills and confidence in making that diagnosis or starting that conversation?
Yeah, perfect segue. Part of the challenge to all of us as a field, and we need to work on this over the coming years, is making sure we have enough providers around the country who have expertise in neurology, internal medicine, geriatric psychiatry, neuropsychology, and so that needs to continue. However, part of this effort actually can involve taking the edge off of the fears and apprehension on the part of family practice providers. Because getting a history and at least an initial screening exam related to cognition, it turns out is not as scary as it thinks. We know that our clinicians around the country are struggling to have enough time to see their patients. And the great news is we have tools that can help just get a gauge of how someone's doing from a memory and thinking standpoint. They don't necessarily take formal training. They don't necessarily take lengthy times to complete them. And so actually, I think part of what we all can work on collectively is making sure that those clinicians who are really on the front lines of seeing patients who may have cognitive concerns are armed with the tools that they can at least start the conversation, start the evaluation, and not feel that they have to solve the mystery right off the bat. But that first step is just so important on both ends, and I think it's something that we all can collectively work on.
Right. I think that's a good perspective. I wonder how that looks in a rural healthcare setting or in communities that might not have the same access to care as they might have in a metro setting.
Yeah, great question. And part of this discussion involves actually recognizing there are some very modifiable causes of cognitive issues. So yes, very often in my practice as a cognitive neurologist, I'm evaluating and diagnosing and managing things like Alzheimer's disease and all of the cousin neurodegenerative diseases that it has. But there are issues related to sleep dysfunction, for example, sleep apnea, vitamin deficiencies, hypothyroidism. There are other causes of cognitive symptoms, and if you never have the conversation of, hey, I have a concern, or my family has a concern, you'll never get to even thinking about some of those causes. And many of those do not require advanced diagnostic testing that might happen in different settings, maybe not as much in the community. And so at least, again, the benefit of having those discussions is that there are tools available right now to start that process.
You mentioned patients really coming forward and advocating for themselves. what would you recommend is a great step forward for families to start this conversation?
Yeah. I find that it can be helpful because of those natural fears and apprehensions about things like Alzheimer's disease to try to put them in perspective. We all, as individuals, can encounter some very, very common medical issues, things like high blood pressure, high cholesterol, diabetes. There's no shame about having those issues. There's no fear about having those issues. The goal is identify them, take the lifestyle and medication and environmental supportive steps to manage them best as you can. And I know that things like Alzheimer's disease are not the same. Mm-hmm. They're not the same. But as much as we can have a perspective that moves the conversation about cognitive issues more towards those other very common, very chronic medical conditions, that's a first step in patients saying, I can own this. I have a concern, or my family member has a concern, and it's okay to talk about it because that's what we're here for.
I'm grateful you brought that up. For the upcoming conference, one of the most important elements of that conference is pairing what we know about the science and the research that's happening around Alzheimer's disease and connecting that to the care that people are receiving and the experiences of the care partners. So important in that is advocacy and being able to have a conversation with your primary care provider. What questions do you need to ask when you're in a specialty setting? And then what does care look like moving forward from there?
And these are so important because I think one of the other barriers that all of us can work to minimize is that medicine and visits to the doctor, they don't have to be top down. When I see my patients, I want decision making and discussion to be shared, because even for things like Alzheimer's disease, even when other family members have Alzheimer's disease, the process doesn't look the same from one person to another. The goal is the person in front of me, how can I optimize their management, their day-to-day, their care? And that means, A, taking into account their goals, their wishes. It also means thinking about that scenario comprehensively. It's not just the patient who's living this. It's their loved one. It's the people around them. It's maybe coworkers. And every patient is going to require a different discussion there. That advocacy can actually come from both sides. It can come from the clinician too. And so again, I think this is a perfect scenario where, yes, we are having so many exciting developments in research in the field, learning about ways to diagnose and hopefully treat things like Alzheimer's disease better. We need to take some of that that's in the abstract and put it right into the appointment in the concrete. And so having those discussions in a comprehensive way, I think, is the priority for all of us.
I'm so grateful for your perspective on that. Thank you so much. We're looking forward to the Mayo Clinic Conference on Brain Health and Dementia on November 4th at the Mayo Civic Center in Rochester, Minnesota. In partnership with the Alzheimer's Association and AARP, we'll be talking about all of the clinical science as well as science related to how can we be better caregivers, how can we be better supporters of caregivers, and really get people the information they need to make good care decisions.